So before we get started, I would wash my hands, perform hand hygiene. But Abby, before we get started, you consent to being filmed and having this video be put on YouTube?
Yes.
Okay, excellent. Well, we are going to do a pulmonary exam. So just going to kind of listen to your lungs and all of that fun stuff. So initially I'm just inspecting. Yeah, I would just be inspecting for any deformities, in the chest. So both anteriorly and posteriorly, any, I guess, like bruises or anything like that. Also, I'm inspecting the AP ratio, so I can see it's about 2 to 1. We could also actually measure this, but I can tell that her chest, the width is about double the size of it is sideways. No barrel chest or anything like that. I'm also just looking at her effort as she breathes and kind of the rate. It's obviously non-labored, no distress, the rate looks like a normal rate. Without timing it, I would say around 14 to 16 breaths per minute. And then next, I'm just also looking for cyanosis in the lips, which I'm not seeing any. Lips are pink, and then same with the fingers. You can look for cyanosis. I guess we can look at both fingernails and any clubbing of the fingernails, which I'm not seeing. Okay, so next I'll do some palpation, kind of your chest, and I'll ask you to do a few things for me, but we'll get to that. So first, I'm gonna check for costal chondral tenderness, which basically is where the ribs meet the sternum. So let me know, is there any tenderness in here? Okay. Any tenderness? Okay. Excellent. And any chest pain, like as you breathe, like there? Okay. Excellent. And next I will check for tactile fremitus. So basically I'm just going to put my hand on your chest, and as I do, like as it touches your chest, just continue to repeat the word 99. And while I'm doing this, I'm just checking for vibrations in my hand, and I want them to be symmetrical essentially as I go from one lung field to another. And that, if they weren't symmetrical, that could be indicative of consolidation in the lungs or, possible pneumonia or something like that. So basically, yeah, just have you say 99.
99. 99. 99. 99. 99. 99. 99.
Okay, and I'll just kind of do it on your back as well here.
99. 99. 99. 99. 99. 99.
Okay, excellent. So it felt symmetrical, the vibrations throughout. Next, I will just kind of check the expansion of your lungs and to see if there's symmetry as you breathe in and out. So basically what I can do is I'll just kind of put my thumbs together, and then I'll just have you take a deep breath in. And I'm just looking to see, and then you can exhale, that her lungs expand evenly and symmetrically, which they did. And I'll do the same on your back here. Okay, excellent. So, yeah, excuse me. So definite symmetry throughout your lungs, which is great. They're both expanding equally. Okay, so next we can, I'm just going to go ahead and do some percussion. So again, basically what I want to see is just, or hear, I guess, and feel is resonance throughout her lung fields. Any dullness, dullness could indicate that I'm on a rib, or again, it could mean there's some consolidation in the lungs, some fluid, or any like tympany could also indicate that. And so obviously we don't want to hear that. So I want to hear resonance throughout. So yeah, I'm just going to do some percussing. And then normally I would want to be mostly on the skin, but you can still kind of hear through the clothes. I'm just going to try to do all lung fields. So far I'm hearing resonance throughout. Try to avoid the scapula. Okay, excellent. So resonance throughout. And then I guess the last thing I'll do, and maybe I guess for the camera, sorry, can you just turn like facing the wall a little bit? So I'm going to do the diaphragmatic excursion test. So basically on this one, what I'll have you do is, I'm just going to pull this up a little bit. You're good, that's fine. So I'll have you breathe in and hold it, and as I do, I'm going to percuss to see basically how far your lung is expanding. So yeah, so go ahead and breathe in. Take a nice deep breath in whenever.
I just did.
Oh, you did? Okay, sorry, I didn't realize. Okay, one more time. Okay. Okay, so exhale. Okay, and then I'll let you in a second here. So take a deep breath in and then a big exhale out and hold it. So we're going to kind of mark that spot. Okay. Okay, so just roughly, you're good. You can breathe. Roughly about that is our difference, kind of in the lung inspiration and expiration, which we want that to be 3 to 6 centimeters. And we can do that again on this other side to check, but for this video, we'll just do the one. But yeah, normally I would do it on both sides to make sure it was equal on each side. So that was perfect. Thank you so much. So now I will listen to your lungs, and so I'm going to listen to all fields, both your front and back side. So I'll start high, kind of even above the clavicle here, and then we'll do the ladder technique going from side to side, so I can assess bilaterally, like symmetry and just from one side to another if there's any differences. So, and basically as my stethoscope's, hopefully it's not too cold, but as it touches you, just take a deep breath in and out. Oh, sorry, okay. Okay, perfect. And now I'm just going to do right here. Oh, either way. Obviously. Okay. Again, avoiding the scapula. Just going side to side. Okay, excellent. So just listen to all the lung sounds. Didn't hear any advantageous sounds. No wheezing, no coarse crackles, no rhonchi, anything like that. So next, and our last thing, I'm just going to check. I believe I'm kind of spacing the word, but I believe it's called a bronchoscopy, something similar to that. But basically, what I'll do is I'll be listening to your lungs, and again, I'll have you say 99. As I'm listening, and basically as I do this, I want to hear kind of a muffled 99. If I hear it sounding like a clear sound, then that could be indicative of fluid or consolidation or anything like that. So again, yeah, I'll just listen, and then I'll just have you say 99 as the stethoscope touches your back, and you continue to say it. So
99, 99, 99, 99, 99, 99, 99, 99, 99, 99,
Okay, and I guess I'll do it on the front as well.
99, 99, 99, 99, 99, 99, 99, 99.
Okay, perfect. So that that sounded great throughout. Yeah, I believe we got everything there. And yeah, it kind of was muffled throughout, so no consolidation. So your lungs sound great. Thank you so much for your help today.